The foundation for PHM is around looking at patients' needs holistically. So, trying to get a much greater understanding around people's experiences in terms of the care that they are receiving now and they might need in the future. We can only do that if we're working together across general practice and primary care more broadly through into secondary care. And we also need to make sure that we've got commissioners working closely with healthcare practitioners.
So clinical leadership is vital in embedding population health management into everyday practice. As clinicians, we're the bridge between the vision and the reality. We can use that data and put context to it and help the analysts understand how we can really make change and build the case for change. The data is a compelling and convincing argument to do that. We can trust in the data that's being given to us, and then we can use that to make a difference to our population. Population health management has really helped us transform how we're looking after people with long-term conditions. It helps us move from more of a reactive, episodic care to more proactive, coordinated care across the system.
The key thing for informing strategic commissioning using population health management is around prevention. It's that better planning, better use of resources, and targeting it for our populations so that we can focus our efforts in the right places.
We've been doing lots of work on something called the NHS Health Check, which is a preventative intervention which adults are entitled to. So who is taking up their NHS Health Check? How effective is their NHS Health Check? Are there inequalities present? And what can we do about that, importantly?
The culture in SNE around addressing health inequalities has always been there. Every person in the system has recognised that actually health inequalities should be at the forefront of everything we do.
I see patients every day and I can see a lot of health inequalities such as smoking issues, unemployment, poverty. We can use the PHM data to identify the health inequalities, but we need that community engagement to say, right, what else can we do?
Population health management enables us to really understand some of those drivers in a level that we probably haven't ever been able to do before. It enables us to really work with our communities impacted by health inequalities to make sure that we come up with joint solutions and interventions that can really make a difference to their health outcomes.
It's not just the PHM team's responsibility to embed PHM, we're actually building that into being everybody's business across the integrated care system.
The PHM team are really supporting the ICS as a whole in terms of training and upskilling colleagues to be able to use Pathfinder.
To be effective, it's about building those communities. It's generating that curiosity and that collaboration. And in terms of leading that arrangement, it's about providing people with the data, the training to help promote population health management, that methodology.
The more people you can involve in doing this, the more quickly you are likely to get to the issues that really matter.
As a result of that training that we have delivered, we've received feedback around kind of self-reported confidence levels to be able to know how to access the data, and if people have bespoke requests that they need support with, how to access the resources and available support.
If you've got the confidence that the change you are going to put into place is going to make a difference, then I think people are much more willing to kind of come with you on that journey and actually start to make a change and look at a new service and work that through.
People need to trust data. If you hold it back from people, if you don't share it, if you make it hard for people to access and see what's going on, that's not a great starting point. And the power of the dashboards, both the Optimum tool and the dashboards that we build ourselves locally, you can say, this is what your population looks like in a way that they have not seen before. So that's really powerful.
It's really about the way in which it's influenced everything that the system is doing, and the way in which PHM has become a focus point for collaboration. I think it's been a really great agent for positive change, and in doing so kind of really tackling some of the fundamental issues that are leading to inequalities that people in our population are experiencing.